Hi guys, my name is Mia. I am a registered nurse for like 6 months now, and I decided that I want to make a video to help any current nurses, future nurses, thinking about going to nursing school. There's a lot that I wish I knew before I went to nursing school, that I wish I knew before I took my NCLEX, that I wish I knew before I got a job. That was all just like a slap in the face each time, and nursing is just a slap in the face always, but I just want to make that just a little bit better for some people. When I was about to take my NCLEX, I literally, instead of studying, I went onto YouTube and was like, how to pass the NCLEX, and I didn't really find anything that helped guide me. I kind of did it all on my own, but I used UWORLD, which a lot of people use. A lot of other people use like HESI and all these, and I forgot what the other one was called, but there's another one. UWORLD was the most recommended, so I did go with it, but it's so overwhelming. So after I decided to go with UWORLD, I would type into YouTube like how to study with UWORLD. I didn't really find anything, and I feel like that was a huge struggle because they have like a test bank of like thousands and thousands of questions. I can't even remember how many questions, but I did all of them, which is insane, but that's how I am. But even I just needed a guide on how to even get through all of those questions, like what was the best way of studying. I figured out on my own, but I feel like I should tell other people how I did it, and you know, maybe it helps you, or maybe it helps guide you in a direction where and you can figure out what works best for you. I also want to do videos on how like nursing really is. I feel like also when I looked at videos of people on YouTube about like their first job, a lot of people were like, yeah, the first year sucks, but like it gets better. And like I've had a job for 6 months now, and I feel like I really want to make a real video, not to scare people, but so people don't feel alone, because I feel really alone when it comes to how much I'm struggling with my job and career choice. Not that I regret it, it's just, it's a lot, and I feel like other people will feel that way, and it's good to have somebody, to know that somebody else feels the same way. So I just want to do all that kind of stuff. Also, just always want to make a YouTube channel, so I'm just doing that as well. Okay, had to stop the camera because I wanted to listen to how I sound. I don't know why I sound like I'm always about to cry. I think that's just my voice. Lucky me. Also, I get extremely out of breath. I'm not a chatty person, so I think since I'm talking so much, literally can't breathe, so wonderful. So next to me I have two things. So at my school, a lot of schools do like HESI and another program, Kaplan maybe, or ATI. My school did ATI, so I have a book here that actually was given to me during school for our comprehensive exit exam that I actually used to help me study along with UWorld for the NCLEX. I'm shocked that I actually like went back and used something from nursing school. But this book is actually really good. It helped me a lot because it just has really good information. So it looks like this. It's the Comprehensive NCLEX RN Review. Super cute color. Anyways, so basically this is a comprehensive book. So this has everything: pharmacology, med-surg, maternity, pediatrics, psych, leadership, everything else I forgot to mention. So can't believe how out of breath I'm getting, honestly. This is ridiculous. The other one is my NCLEX notebook. I kept this because I worked hard in this book. So basically, when you're on UWorld, you get your questions, and then when you answer the question, just like most tests that you take in nursing school, you get rationales as to why each answer is incorrect or correct. So I think that is the best part about UWorld, despite the fact that UWorld is structured and looks the same exact way as your NCLEX looks. So when you take your NCLEX, that's one less thing to be like freaking out about, even though it's just like a little sliver, but it really helps because you already know like how to click the questions and like all that kind of stuff. Is just a familiar thing to look at, which is very soothing when like it comes to like, oh, I don't even know how this is gonna look and blah blah blah, whatever. So UWorld, when you go into UWorld, it has thousands of questions, and it is by like med-surg, pediatrics, leadership, fundamentals, pharmacology, maternity, pediatrics, already said that. You get the deal. So I was just like, how the hell am I gonna do all of these, and how should I do them? So UWorld only gives you a max of 75 questions in each practice exam that you take, which is cool because on the NCLEX, the least amount of questions you can get is 75, the most is 250. Don't know if that's changing, but so it got you very used to getting through 75 questions, and so that was nice as well. So I was just like, okay, I can only do up to 75, so I'm gonna do 75. But I was like, how do I do this? Do I just do random? Do I just do one subject? So I broke it up, because that's also a better way to write everything down when it comes to rationales in a notebook, or you could type it out, but I have to write it down. It's a muscle memory thing. I color coordinate. I'm a very big, what's that called? Highlighter person, and like highlighting certain things this color and that color, and like sticky notes and all that kind of stuff. So that's what helped me. So I started with med-surg because that was the biggest one. I had like I don't even know, like maybe 900 questions in just med-surg. So I graduated April 2019. I took my test June 3rd, 2019. I had probably a week where I was just like, I'm not doing anything, which is okay. And after that, I studied 5 days a week, and I didn't study on weekends except the week before I studied on the weekend. Basically, I would do 75 questions in the morning, 75 questions like around lunch, 75 questions like around dinner, basically. That is a lot. It was really overwhelming. By the 75 questions around dinner, I would do much worse, just because I was tired, but I did want to get through them, and I never slacked when it came to writing. If I didn't know something, I would write it down. And the biggest piece of advice I have is, if you know something, do not write it down. I would do that because I wanted a confidence booster, because I was like, I know this, so like woohoo, but like, bitch, like, you know it, like, you don't have to write it down. So don't do that, because it's just, your hand is already gonna hurt, and if you know it, you know it. Like, if you still know it from school, you're still gonna know it on your NCLEX day. Write down the stuff you don't know. I wrote down so much, so yeah. So I would do, that's how I would study. That's probably not easy for everybody to do that much every single day, because of full-time jobs, kids, literally anything, or just because like your brain can't handle that much. But I was very set on a schedule. I get very like, I have to do this much, like, or I can't do anything when it comes to that kind of stuff. So I would take notes like so. Oh my god, having flashbacks. Alright, so this is NCLEX. It says basic adult health. Maybe that's what it's called instead of med-surg, but that's what it means basically. So like, I had a question on colorectal cancer, got it wrong. So I would put signs and symptoms of colorectal cancer, and then I would write down everything right here. And like, I would just, but I would always leave space, like, because you will always get another question probably, so I would leave a few lines so I could, you know, write more if I have to. And if I didn't have enough, like, I would like number the notebook pages and be like, refer to page blah 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 for more. So because at the end of it, I would only just study from here when I finished all my questions, like 2 or 3 days before the test. So I mean, this girl is full. So like, something I never got was neuro. I was just really bad at it. I didn't care. I didn't want to know what each lobe does. Ask me now. don't know. But like this is, I even drew a picture. I'm so ridiculous. I drew the picture probably because the picture was on UWorld and I was like, okay, fine. So it's like parietal lobe, sensory, frontal is behavioral. I have to look at it because I literally have no idea. Temporal is auditory, occipital, visual. So it's just showing you the brain, basically. And like, because there's questions on the NCLEX that are pictures. So I was like, I will never know. And it was just, there's so much in here. There's a lot of, so basically how it works is you take the 75 question exam and then you get a percent, like a regular exam. At first, for the first week, I would get in the 40s and 50s. And I was like, oh my god, like, I'm never gonna pass. What do I do now? So out of breath. And then as the weeks went on, I would get 60s, and then I would get 70s and 80s. Never got 90s. The only time I got a 90 was on the comprehensive. They have 2 comprehensive exams you can take, which give you the likely percentage chance of you passing the NCLEX, and I got 90s on those, so I was like ready. So I think the best advice I can give you is structure it. Like, I could not do the UWorld exams randomized. Like, I felt like I did much better because I would do pharmacology. I don't remember how it went, but then if I reviewed my pharmacology, I would do better on other things because I just reviewed it, and then I would go back into my notebook and I would see like, oh, I wrote this down and like all this kind of stuff. You have to read the rationales. That's the best part about UWorld, because you find out information that you don't even know. And there was, I'm gonna say, I mean, it doesn't sound like a lot, but there was probably about 10 questions on my actual NCLEX exam that I would not have gotten right if I didn't read rationales from UWorld, because it was 2 and 2 together. And a lot of those questions, about 10 of those, I had a lot of psych on my NCLEX. And how the NCLEX is structured, they say, is like you get a certain subject wrong, so they just give you more questions in that subject to see if you're ever gonna get it, if it's gonna click, or you're just like, nope, can't do it. So I got a lot of psych, I got a lot of pre-op, intra-op, and peri-op. I was like, what? Like post-op. And then I got pharmacology, but like not even like the, what drug is this? What side effect does this drug have? It was like, what is a mechanism of action on said cell from said medication? I was like, what? Definitely got those wrong. I'm not gonna get too into everything right now. I just wanted to give advice on how to structure studying with UWorld. And really take your time. It took me about a month to take my test. It takes some people 2 months, but I think I'll have like my personal NCLEX story like as a different video if this even goes well. So, and then I will also maybe I'll do a more in-depth video of how my notes actually look, so it's not me just going like it's just me going over how my notes are structured. So that is that. So I'm just doing this for fun. I don't want my whole entire channel, if this even becomes a thing, to be about nursing. I do enjoy like watching vlogs and like day in the life and all that kind of stuff, so I do want it to be kind of like a versatile channel, something relatable. This is if anybody even watches it. But I mean, if you like it, let me know. If you don't, I guess let me know. And if you have any questions, feel free to ask. And if you have any recommendations or things you want to know, also feel free to comment or ask and subscribe. Oh my god. Okay, well, thanks for watching, seriously, and I can't wait to see where this journey brings me.